Hi, and welcome back to the Ageless Pet podcast. And this is your host, Dr. Gabby Varco.
And Dr. Carmen Balsani.
And on today's episode, we're going to dive into something a little ancient and a lot amazing. We're going to talk about acupuncture for animals.
Love it.
Yeah, it's great. It's what we both do every day.
Mm-hmm.
And we're going to just kind of go through what is acupuncture, what it isn't, safety,
Right.
and then we're going to have a follow-up episode talking about some literature about acupuncture, because that's really important. So basically, this has been done for thousands of years. It is not new medicine, and it's not just acupuncture, which we'll talk about. And it involves placing really fine needles. I know needle placement sounds really scary, but they're really small, thin, bendy needles. And we put them into something called acupoints. And there's meridians. It's like all these highways, and it's really fascinating. But these points are connected by pathways called the meridians. And then there's a flow of energy, or chi. And that's really fun. And then we're going to just talk about how it works and how it can be beneficial for not just dogs and cats, but all sorts of animals and people.
Yeah, no, I love that. I think the meridian chi conversation, is so, I know, is so very Chinese, right?
Yeah.
So, what do you want to say? Almost mystical in our
Yeah.
realm, but in Western, it's like I don't understand what you're talking about with all that kind of stuff. But as we know, chi just means life force, right? So energy, life force, whatever you want to call it. I think we all know what life force is, and in essence, we see people who have a lot of life force who are older, and we see people who don't have a lot of life force.
Yeah.
So it's not mystical. I don't know what you call it in Western medicine. Vigor, I guess you can call it.
That sounds like a great, yep.
Whatever. So, and there's another thing too, is just with this meridian thing, there's just a lot of stuff we don't understand in Western medicine as well. And Dr. Varco and I were just talking about this really cool Radiolab episode that happened in I think it was like November 2023 about the interstitium. And that interstitium, which we all have, it's all the part of our body that just hangs out and all the cells that are connected in it, and we've always thought it was just matrix to hold everything together, but now they're finding that that's not the case, and there are some theories that the meridians run through these interstitial channels. So just because it's old and just because it is not well understood doesn't mean it doesn't exist.
Right.
So,
yeah. And
anyways.
That's a primary form of patient care and healthcare in a lot of countries.
Yeah.
And they are really successful. And we won't talk too much about herbs in this one. We'll have a whole other episode. But there's some really powerful herbs for like bleeding and all sorts of stuff that have evidence behind them as well. So it's going to be a really fun conversation today. And like you said, in Western medicine, they're starting to teach medical acupuncture in Western terms. So veterinarians that don't do the whole Chinese medicine are still getting trained in acupuncture, but it's targeting the nervous system and those acupoints, which are, a lot of nerve bundles, low electrical resistance, high electrical conductivity. That's what those acupoints are. And they're kind of looking at it in, hey, the nervous system controls the entire body. We're going to stimulate this nerve. And by the way, there's this gallbladder 34 over this bundle of nerves. And then it does X, Y, and Z.
Right. Yeah, I do like that. I like the westernization or the understanding through Western terms.
Yeah.
Whether it's due to whatever factor you just said. But I also don't like it because it does take out acupuncture from a whole form of medicine.
Right.
That, exists. So
yeah, we're mainstreaming it, which brings it to more people and animals, but at the same time takes away the essence, the core of what it truly is. Right.
And the thing is that makes it so hard for me is that there are Western acupuncture courses in veterinary medicine. I know there is in human medicine as well, but what gets me is acupuncture is a form or a part of Chinese medicine, right? So it's part of, there's massage called tuinya, there's exercises called qigong, there's food therapy, there's lifestyle, there's herbs. So there's so many different factors. To me, it's like taking acupuncture away from Chinese medicine, the theory, the concept, the qi, the meridian, the dampness, the heats, excess deficiency, etc., is like taking surgery out of Western medicine. Or actually, let's just say it's like taking antibiotics or drugs away from Western medicine, and all you're allowed to do is do surgery.
Right.
So for me, I understand the point of doing it, but think about if your herbs and your lifestyle and your dietary therapy were taken away. It's literally like saying in Western medicine that all I can do for heart disease is open heart surgery and placing stents. I'm not going to tell you to exercise more. Right. I'm not going to tell you to eat better. I'm not going to put you on medicines like Lasix or any of these diuretics or cardiac stimulants or, any of these other drugs that are used commonly. And then just see how we do with just acupuncture or just surgery.
Right.
So that's what I feel like we're doing in the westernization of acupuncture. I feel it's not fair because we're pulling acupuncture and saying, let's see what these acupuncture studies do, and we'll talk about that in our next episode. But what does acupuncture do? Is that making things better? Is it not making things better? Right. Spoiler alert, the results are mixed. But
shocking. Science isn't straightforward.
Which is good, actually, because it makes us do our thing a little bit better. But to, like I said, to pull acupuncture out and say acupuncture doesn't work is fine, but it's not fine because you're not taking it. It's like taking, surgery for your heart and saying, well, that didn't work. Well, you didn't address diet, you didn't address lifestyle, you didn't lose 40 pounds that you should have left, you didn't exercise, you didn't do anything else, and so it didn't work. Well, no shit, it didn't work, so that's just kind of my soapbox now. I will stand off of it.
No, it's honestly a really great soapbox to have because I feel like when I first learned Chinese medicine, I was a lot more engulfed in it. Yeah. And then you work at practices where they incorporate acupuncture, but there's no tongue and pulse, there's no TCVM diagnosis, traditional Chinese vet med. And then over the years, I've gotten pretty rusty, and we had that whole conversation about me wanting to, just dive in and use, I do food therapy and I do some of the manual therapies and the acu, but I don't do a lot of herbs and or at least Chinese. I do more Western. Right. And trying to kind of incorporate all of that because it is a whole healthcare system that works together. It's not just one component. So,
well, and I'm just the opposite, right? So I'm totally engulfed into Chinese medicine. However, when I first graduated from I did IVDD, International Veterinary Acupuncturist Society, and you did the Qi Institute, obviously, and but when I graduated, I thought that acupuncture and herbal medicine fixed everything. And so I felt like I was a failure or a cheat when I would use Western medicine, in addition. But it's not true. Western medicine exists for a reason. I mean, you break a leg, I'm not going to acupuncture you to make your leg get better, And into that same vein, if I need to use some, pain medicine or some real medicine, like if your heart is failing and I have to give you Pimobendin or Lasix, I'm going to do that. I'm not going to rely on all the only rely on, the energy movers, the chi movers, the blood movers, acupuncture and everything else. So it is, you can call it complementary. I don't like the word alternative. But it's fine if you feel that way, that you want to use alternative, but it can be an adjunctive therapy to Western medicine, and it's not a failure to use Western medicine, nor is it a failure for Western medicine to use complementary medicine. So, we have all these tools in our toolbox, whether it's acupuncture, laser, shockwave, physical therapy, etc. Why don't we use them? Why do we have to be so dogmatic in any of them? So
I know, and I do find that some people and practitioners will be like, I only want Chinese medicine, or I only want Western medicine.
I have that too.
They both bring so much to the table, and we want a multimodal approach, and ultimately, don't we want what works and what's going to improve the quality of life for your patient or yourself? And like we're going to talk about in the next episode, but one of the things that we were chatting about was how some of these outcome measures that were done were like, hey, there was improvement in pain level and behavior, but their lameness scores were the same. It's like, but that doesn't mean that it failed.
Right.
Because we're getting improvement in the overall quality of life, and maybe they're still showing some signs of lameness, but it's not a panacea. This is not going to like fix everything, but I think we need to look at it in a very...
But it can be such an adjunctive, wonderful additive. And I always think about this in Western medicine, and I think that everybody knows this, but Western medicine treats a lot of stuff, but there's a lot of side effects to Western medicine. Has anyone watched TV recently? Whatever Nutruda or whatever the hell the drug name is, or all these GLP-1s, the side effects on these treatments are significant. Surgery, the side effects can be significant. No surgery should be taken into lightly. You know, there are side effects that can happen. So while Western medicine can be very productive, very effective, how many people do we know that are on a drug and then another drug to treat the side effects of the first drug, or more than one drug? You know what I mean? So nothing's wrong with Western medicine, but it is a big ass hammer. I mean, it's a hammer, and it's going to hit a lot of stuff, and there will be, you know, collateral damage with that hammer. If I hit my hammer with my knee to fix a problem, I'm probably going to have some side effects to that hammer hit. So why not use something that may be a little less hammer, like more like a little ball peen hammer as opposed to the sledgehammer? You know, get your acupuncture needles in there, and then maybe, you know, see what happens, add some herbal therapies, add some Western medicine if needed, but do it in a very cognitive manner, you know, very thoughtful manner, not just a one-size-fits-all manner.
Yeah, and along those lines, I would love for people to understand that Western medicine works quickly, and Eastern medicine takes a little bit longer in a lot of cases.
Very good point.
So you can get pretty quick effects with Eastern medicine, but in general...
It takes time.
It takes time.
Unless you have a very young dog who has a lot of chi, life force, and usually 1 or 2 acupuncture sessions is all you need, because they can heal themselves pretty quickly. You know, but I always say this too with like, you know, Western medicine, if I have an arthritic dog, you know, throw them on some NSAIDs, throw them on some whatever you want to throw them on. Don't really matter, right? Because one size fits all. But if I'm going to do acupuncture, chiropractic, or laser therapy, I'd really like to know what I'm treating or where I'm treating, because it's going to depend where I put my needles, etc. So, a lot of times I'll recommend X-rays, because what does this knee look like? What does this hip look like? What is? But if I'm only going to do NSAIDs, who cares, right? Because one size fits all. It's like it's pain management, and here you go. I mean, maybe I'll put them on a nutraceutical that might be good for a joint, but really I don't think there's that much nuance in Western medicine. And correct me if you think I'm wrong.
Well, I mean, it's obviously nothing is that simple, right?
Right, of course.
I think that brings a really good point. When I remember this so clearly, and I did my Acu training quite a few years ago, but one of the things that really stood out to me was that individuality, and they brought the case of 2 German Shepherds are presented to you for vomiting and diarrhea. Western medicine, you're pretty much going to treat them the same across the board. However, German Shepherd A is older, has a pale tongue, has very mucousy, watery diarrhea, is very not really eating. German Shepherd 2 is young, has very, very malodorous, soft, runny diarrhea. So very similar presentations, but one's deficient, one's excess. You're going to treat them differently in Chinese medicine, and it's very individualized. And there's some of the stuff's going to overlap, but in general, Western medicine, you're kind of looking at it. And this is not, we are not disparaging Western medicine. We both practice it, right? We practice it, but I do love that Chinese medicine gives you that time to just pause for a second and say, okay, what are the pulses doing? What does the tongue look like? Is this dog heat seeking, cool seeking? Do they want a hard surface to lay on, or do they want a soft bed? Are they a dreamer? Like, there's all of these different things that we think about when we're formulating our plan, and it just takes thought and time and patience, and it's just very individualized.
And there is the crux of the problem with acupuncture
there
research.
It is.
because, the first description of that German Shepherd was a spleen deficient patient. The second one was a heat patient, right? Excess patient. You can't treat both of them with acupuncture the same way. They're not going to get better. The deficient one needs tonification. So what that means in in Chinese medicines, we're going to need to build up their blood or their qi. That might take some time, but we can do it, and we use herbs to do that as well. But I'm going to use different acupuncture points to build up a spleen. I might be using stomach and spleen points. What if I have an excessive patient? I'm going to be draining some heat points. I might be draining some dampness points. Not that I wouldn't do that on a deficient patient as well, but they're very different presentations.
Yeah.
So to put those into a Western medical term and be like diarrhea, treat it with your acupuncture points. I'm going to give you 20 you can use or whatever.
Yeah.
Fine. But how many acupuncture points are there? I don't even know, to be honest with you. I think there's I don't even know. I'm going to sound like an idiot but there's a lot of them. And, hundreds. But at the end of the day, when you put a patient in a box and say it has diarrhea, this is a Western medical term, right? It's diarrhea. So it's difficult to, even limping or pain, is it blood stagnation? Is it qi stagnation? What is it? And those are treated differently, so it's really hard, whether it's herbal therapy or acupuncture, to do research in a very simplistic manner, because you're putting Chinese medical diagnosis in Western terms, which doesn't work all the time.
Right.
So,
but I do love that they're doing research.
Yeah.
It's just like you said, if you're comparing two different patterns and you're using the same points for both, there's going to be overlap, right? Like there's going to be overlap, but like you said, you're likely not going to do heat clearing points for that spleen deficient dog.
No.
So there are going to be some points that you use for one and not the other.
Right.
And then if you're not, unless you have that exact pattern in enough dogs that you can have a statistically significant outcome,
right,
not 3 dogs with, spleen qi and 3 dogs with excess or whatever. And it's just really challenging to do.
Right.
And so we have to look at the research and say, okay, this can be beneficial, but...
Right. Yeah, not to mention acupuncture is fine for that qi deficient or the excess patient, but there's herbs you're going to use totally differently. Again,
yeah,
pulling acupuncture out of the Chinese medical system is not fair for analysis of acupuncture.
Right.
Acupuncture is fine. It works sometimes. It doesn't work sometimes. But herbs work sometimes where acupuncture doesn't. Dietary therapy, exercise, tween-yang, massage, qigong for people. It's a medical system. Don't separate it and parse it out and say it doesn't work. But again, Western medicine 100% is very viable for a lot of cases. And, sometimes I'm doing my acupuncture and things aren't getting better, and my nutraceuticals and my Western herbs and my Chinese herbs aren't working, and my homeopathy is not working. So guess what? I may reach for an NSAID.
Right.
And a lot of times that works. A lot of times it doesn't. So it just depends. But anyways, there we go. I guess we are both on our soapboxes.
A little bit, yeah. But it was like the same soapbox. I think it was a big box. There was room for both of us. Yeah, but
True.
But it's great because, it's very safe.
Very safe.
But there are some things that we don't want to use acupuncture for,
right,
or we just want to do it in a very cautious way. So certain contraindications are, and we'll talk about all the different things that can go on in an acupuncture session, right? Because there's electroacupuncture,
right,
there's aquapuncture, there's laser puncture. It's not just putting in dry needles.
Right.
But with that being said, we have a seizuring patient. We use acupuncture to treat seizures.
Right.
We would not use electroacupuncture to treat seizures.
Exactly. Just like with a cancer patient,
right,
you can 100% use acupuncture to treat that cancer patient, and I do that on a daily basis. But I am not going to stick needles next to a big tumor.
Right.
That's a no-no.
Right.
And from a Chinese medical point, you're just increasing, qi or energy to the system, of relaxing the meridian to let more of that stuff get into that tumor. From a Western medical point of view, you're increasing blood flow to the tumor,
right.
which is not what you want to do. If
Either
you
way,
no,
not great.
So that's another contraindication is tumors. Don't acupuncture around a tumor, but definitely acupuncture a tumor or a cancer patient, but not the tumor itself.
Right. And then, heart disease, we acupuncture cardiac cases, but if there's a cardiac arrhythmia, you have to be very cautious or avoid electroacupuncture. Right. Again, electricity.
Right.
That's and it's not shocking. We're not shocking them. It feels almost like when you have a TENS unit on. If you've ever had electro. So. Yeah. So so when you're watching your dog or cat or guinea pig or whoever get electroacupuncture, it is just a very gentle, soothing sensation that releases endorphins and enkephalins and all sorts of really good feel-good stuff, and can help with internal organ function and things like that. But yeah, it's not painful.
No.
Yeah.
It's not painful unless you hit a painful point.
Right. And we will definitely talk about that. Pregnancy is not a direct contraindication, but there are certain points that are contraindication. I think for me, because the gestation period is so short, I tend to just avoid it in pregnant animals and just say, hey, we're just gonna wait on this, and that's just me. Safe. Yeah. I rather.
And if you were going to do acupuncture on a pregnant animal, I think it is safe to wait. But if you were going to do it, then I would pretty much be doing just local points, none of those distal energetic points. Because that's when you're going to get into trouble when you're doing all those points. When my wife was pregnant with our second one, her first labor was very long and stalled and etc. So her second one, we were in the hospital, and I started massaging, doing acupressure on some of her acupressure points on her hands and on her feet. And within, I'm not exaggerating at all, within minutes, she went from contractions once every 9-10 minutes to contractions every 2 or 3 minutes.
Yeah.
And she said, I had another one. And then I had another one. And I was like, are you sure? Which was the dumbest question a man could ask to a pregnant woman. And then her water broke, and she says to this day that she's never seen me run so fast and get the nurses and so forth. And then she had a very precipitous labor, and had the nurse deliver the baby because it was coming, and the doctor was in a C-section. So was it the acupressure? Maybe not. But there was a very big difference in number 1 and number 2. So it's not causation, correlation, blah, 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 but still very interesting.
Absolutely. And there's a reason that certain points are contraindicated, right? Because they can stimulate labor and things like that. So that's why you just have to be careful and know what you're doing. Yeah,
they're usually below the knee, knee or elbow. So don't touch those points if you're going to do it. But, I love Dr. Varco's point as far as, it's only 2 months. If we can hang out for 2 months, that would be great. If you can't, then you can do other points.
And just be careful about it.
Be very careful.
Moxa in the summertime. Don't want to do that.
Nope.
Moxa is an herb that we usually burn and put near specific points, but it's a very, very warming technique. So you don't want to do it when there's excess heat, including summertime.
And almost always when I would do moxibustion, it's a chrysanthemum flower that burns, I can't remember, it's 400 and something degrees, and it's commonly used in human medicine or human acupuncture with cupping, so they'll burn a piece of this moxa on top of usually ginger or cucumber or whatever, and then put a cup over it. And you've seen it in the Olympics where all these people have these big round circles all over their bodies, because they just got cupped, but anyways, though, almost always in the wintertime. It's November through February, almost always. And I've never even thought about reaching for it in the summer. It just seemed wrong, because we know you're putting chi, or you're putting energy into an acupuncture point, and usually in the heat time, there's already a lot of energy there. So,
Yeah, and then another one is really severe skin. And this is tricky because we do treat skin conditions, right? Allergies and things like that. But
those are hard.
Some patients, and there's every level of severity, but I've had patients where their skin was just so affected, generalized. And they have, resistant, multi-drug resistant skin infections and lesions. And it's let's hold off on this. There's the other branches, right? There's herbs, there's diet, there's all sorts of things that we can do that aren't putting needles into really
infected
affected
areas.
skin.
Yeah, and I think that the obvious reason, right, is because now I'm penetrating a skin that's infected. So am I driving the infection deeper?
Right.
Definitely could be.
Right.
So that's the, a medical sense. The other one is just, when your skin's on fire and you stick a needle in it, it hurts.
Yeah.
And sometimes I can't even pet them without them going bananas. So, sticking a needle in a point that hurts like that, that's the whole body that hurts, is not a good idea.
Yeah. So those are kind of the main cautions and contraindications. I mean, there's others, right? Like there's a whole list, but there's not a lot because it is a fairly safe. With that being said, sometimes we do get some adverse effects.
Right.
So healing crisis.
Right. Yeah, healing crisis. I was taught that the hard way when I first finished acupuncture training, and you have a older cat and you want to help this animal out. He's got kidney disease and she's thin and she's dehydrated, and you stick like 30 needles in them because you don't know what you're doing. And so you're trying in the beginning, and you're trying to use all the points that the books say.
Right.
And then the cat goes home and sleeps for 3 days.
Right.
And then is not eating and is not drinking. So it looks bad, right? Now after that, then they feel great, but you have to be aware of how many needles and what points you're using, or you could have side effects. Like usually the side effect I see the most is lethargy. But sometimes I've seen animals, you've probably seen this too, get worse with acupuncture up to 3 days. So that would be a healing crisis as well, because you're stimulating.
I've had healing crisis. Like I know what it feels like, and so I could pretty much be like, all right, I could see that for some of the patients. And I try to remember to tell clients, like, hey, every once in a while we see a healing crisis, don't panic. But, there's so much to talk about in these appointments. Sometimes I forget, But it is important to kind of know that it's not anything detrimental. It's just the body is doing a lot. We're essentially stimulating the body to try to heal itself.
Right.
And so the body's working really hard.
Right.
And so it's a lot.
It is a lot. And just think about it. Like say your hip hurts, for example. So your hip is hurting, and so what are you going to do? You're going to stick needles into your hip. That might make things worse, because your body has done things like maybe actually, reduced your mobility, and your fascia is tightened. Less blood flow might be going to that area. Now, guess what I'm doing now? I'm pushing a lot of blood to that area by basically telling the body, here, go to this area, I need you to fix it.
Right.
And the body's like, well, I've taken that offline, months ago because it's not working. And I'm like, no, I want you to fix it.
Right.
So it works, but now I'm increasing blood. I'm, changing, like I said, there's maybe fibrosis and stuff like that. So you can easily cause a healing crisis, but it's only temporary. Nothing's going to be like, oh my God, I made him worse, now he has to go to surgery. That's not going to happen. So just usually lasts for 1 to 3 days at the most, if at all. Right.
And that's another really good point, because obviously you have local points, but you also have back shoe points and distal points, meaning there's points all over the body that do different things. And if that dog has an issue with one of the legs, but the leg is bandaged, or they're laying on that leg and will not comfortably lay on the other, we can acupuncture the other side.
Right. Well, that's a good
and
point. Very good
a lot of times people are like, oh, that's the wrong leg. And it's like, but that's okay, because we're still getting, and some dogs may be very guarded around the actual limb, and they're going to be very uncomfortable if you attempt to needle it. So you could do the other one, and then there's mirroring, right? So you could do a thoracic limb to treat a pelvic limb. There's so many different techniques.
Right.
And everybody, acupuncture's, it's healthcare, but it's also an art.
Right.
And you're going to treat the patient that's in front of you also. So if you're feeling a point that's deficient or excess, and you're like, oh, I'm going to do this, it might not be something that you planned on. Sometimes I have an idea of what I'm going to, where I'm going to put my needles, and then I look at the dog and I'm like, oh my God, your tongue is like beet red. Right. I need to clear some heat, or hey, they have X, Y, or Z.
Good point.
My prescription per se is going to change a little bit, and it's going to change based on what I'm feeling, what I'm seeing. And so...
And what the dog allows you to do.
And what the dog allows you to do,
right. Some
exactly.
dogs hate their feet touched. So one of the really great pain points, for example, is liver 3.
Yeah.
Which, again, is distal down in between in your toes. So why would I be sticking a needle in liver 3 if you have hip pain, right? Well, it's a well-known pain point. There's many others as well, but some dogs don't like you to touch that.
Right.
I really want to use liver 3. Well, I can't, you know, because the dog won't let me. So then I'm going to use other points, and it might be stomach 36 on the knee on the opposite side of the painful knee. You never know. Or it might be on, like you said, the contralateral, the front leg for a back leg problem, and it might be on the opposite side. If you have a left leg, I might do right front leg points. But it's not like I'm a quack, or there's a reason for it, and there's a reason the dog might not want it, or we can't do it, or the dog's too painful, or numerous things.
Right, and different people do different points.
Oh my God,
so we all acupuncture each other's patients, and there'll be times where they're like, oh, well, last time they put a point here.
Right.
And it's like, okay, I can definitely do that, but a lot of the points do various things.
Right.
So, you know, like you said, points that are local, points that are distal, systemic points, and we're going to treat what's in front of us and also what our training. I mean, for the most part, we're all trained very similarly, but not every single point. You're not going to do the same thing every single time. Right.
Now, I hate to even say this, but some of the acupuncture points, I forget their names, but I will stick a needle in something that is hot. You know? Or cold. I don't really feel a lot of cold. I usually feel a lot of heat or sponginess. But if something's hot, I'm sticking a needle in it. You know, and I don't even know what that point is. I'm like, that's a hot point. I'll go look it up later and go, what the heck? What was that point? Why'd that mean? So then it'll help me diagnose better. But if I have a lot of back heat in certain points, I'm going to stick needles in it, even if it's a hip dog or a dog who's got hip arthritis, and I find back or knee or anything else, I'm sticking a needle in that.
Absolutely. Or they come in and they're like, oh, they're having an acute on chronic, whatever you're treating. Some of those points are going to be a little bit different because you have to address this like acute part. So it's not the same thing. And when I go see my acupuncturist, who is magnificent, and I absolutely love her, but she doesn't do the same things every single time.
Right.
You know, we have a conversation about what's going on. And it's different in humans because she can feel points on both sides and ask me which one's more sensitive or how one's feeling versus another. And then because we both have had acupuncture, we feel pretty comfortable in telling clients this is not a painful thing, but there are times that you put a needle in and you get a reaction from the patient. And those are zingers or stingy or whatever they are. But we've all experienced them, so I usually try to comfort clients because clients don't like to see that you put a needle in their dog and their dog whips around and shows you their teeth or whips around and is like, whoa.
I had that on Wednesday.
Oh, gosh. And we're not hurting them.
Right.
It's a very safe thing to do when done by somebody, a veterinarian trained in this technique and this type of medicine. It's very safe. But there are points that are a little bit uncomfortable when they first come in.
What's the term that they use? Da-chi. So we release da-chi. But it basically means that we hit a point that needs to be stimulated. And it's a painful point. And, you know, you end up finding that out by a dog whipping around or a dog, you know, a nice dog might just, you know, if I'm doing a back point, it might, and they're standing up, they might drop their back a little bit. Or if they're laying down, they might turn around and look at me. But that point hurts, you know, and so stimulating that point, releasing some energy, increasing blood flow, increasing the meridian flow is important. Now, obviously, if something's really painful, like I have an acute disc injury or a back spasm or something, I'm going to go above and below that area because I don't want to hurt that animal. Right. You know, so it's fine to stimulate above, fine to stimulate below a point that's really painful, but sometimes if it's not exquisitely painful or we don't know it is, and then we stick a needle in it, then you know. But, you know, usually when that happens, that dog gets better because you are releasing that energy and increasing blood flow. So, but sometimes things do hurt. So
of course. And then there's different techniques like we talked a little bit about, but there's acupuncture. And I do a lot of B12 with my acupuncture. I've worked with clinicians that do B complex. That's a little more stingy, so I kind of stay away from that. just, homeopathy, like you were talking about. There's a lot of different things that you can inject, and basically you have your dry needle, and then your acupuncture, your electroacupuncture, and then laser acupuncture. So you could stimulate points using laser therapy. So there's a lot of different ways, but if I have a patient that just doesn't tolerate needles, or they only let me put in a couple, then I'll do a combination.
Yeah, sometimes you're right. Sometimes it's like, okay, well, in particular with exotic animals, I find it being difficult because, like rabbits, some people say, oh, rabbits love acupuncture. I'm going to call bullshit on that. It's important to do acupuncture on certain conditions with rabbits if they allow it, especially for, like, instance, GI stasis or gastrointestinal problems, because they are in a world of hurt anyways, and so they don't really care that I'm stimulating a back point or a knee point or some point right next to their eyeball, because they are feeling that they're going to get some energy movement and so forth. So but laser acupuncture for those animals is amazing. So I do laser stimulation of acupuncture points on birds and rabbits and in guinea pigs a lot, and even cats. Cats are sometimes challenging, right? I say sometimes, that's a joke. They're always challenging.
Well, I do, because we do have patients that you can get 2-3 needles in them, and then that's it. You've hit you're done. And so
the cat lets you know you're done too, huh?
I've had some dogs let me know they're done too. But it's great, because then I know I could still treat them.
Right.
And with that being said, we don't need a lot of needles. We just need the right ones.
Right.
And there's certain techniques, like balancing techniques and things like that. You're literally just using a handful of needles.
Yeah, some people use like 3 to 4 needles, and that's it.
It's amazing. And that's what I want to get across, is that there's a lot of different ways to do it. And there is no, and there's air quotes here, getting your money's worth, right? Like leaving it in. I had a client who, the needles were in this dog for like 20 minutes, and I'm pulling needles, and he's like, what are you doing? And I was like, oh, we're done. And he's like, well, you're not doing it right. And I was like, oh. And I wanted to know what his impression of what I did. And he goes, well, I've had acupuncture done for my dog, and they left the needles in for an hour.
Wow,
and you're not leaving them in for an hour.
Wow.
And so he felt like he wasn't getting his money's worth, because the needles weren't in for an hour. And I don't know anybody who leaves their needles in for an hour on every case all the time. And I was very taken back by that. And I wanted to explain to him, obviously his perception was I paid for the service and I didn't get my full service. And so you don't need a lot of needles. You don't need an hour.
Yeah, I've done it before. We left it in an hour, but usually because I forgot that they were in the room.
Gosh.
I'm like, shit, they're still in that room. I gotta go get the needle out. It doesn't happen. I'm just kidding. But it's happened once. But also there's forms of acupuncture where you literally, and I think it's a Japanese form of acupuncture, where you literally stick the needle in and pull it out.
Yes.
And that's it.
Right.
So
no needle retention time.
No needle retention time. And they do it oftentimes in children or geriatric people. So I don't get weirded out at all when a needle falls out. Like, all these needles fell down. I don't care. It's nice if I can keep them in there, but I already stimulated that point. I already got that in there. And is the needle staying in there continually stimulating a point? Maybe not. Maybe it's just a puncturing of the fascia or the stimulating of the interstitium that did its job. So 20 minutes, 5 minutes, an hour, a second. I don't know. And there's no real good studies, obviously, but there's definitely lots of different forms of doing it that's worked for a long time.
If a needle falls out, especially towards the beginning, I think the dog's moving or whatever, I'll put it back in. But if it falls out again, I'm like, the body just is done with that. And I honor that. Like, I think for me, the big thing is I can't sit here and be like, oh, well, I intended to put this needle in and I need to make sure that it stays in. Like, I'm there to help the body do what the body's going to do. And if the body says, I want this needle longer, and I have a sticky needle, which I love sticky needles. That just means that you go to pull it, and it doesn't come out, and it will actually pull and tent the skin. And I had done acupuncture for my boss's dog, and her, she's a veterinarian, and I had gone to her house, and her dog had chronic thoracic limb lameness, and I was like, okay, I have to go back to work. You know, I did it on my lunch break, and all the needles came out except for this one. I think it was like small intestine 9 or something. Great one for the front leg, and it wouldn't come out. So she was like, I'll sit with him, you know, whatever. And she said she almost called me because she thought she was going to have to take him into work and surgically remove this needle, because she was saying she would pull on it and it would not come out. And she was like, oh my gosh, this is so annoying. And she said like an hour or so later, she went to pull it and it came out smoothly. Right. And she thought it was going to be bent, and it was perfectly straight needle. And that his lameness had improved after that. Right. And sometimes, to your point, I think there's a lot of tangents in this episode. To your point, if the body keeps spitting it out, it's done with it. Right. And if the body holds on to it, it needs a little longer. And I try to honor that to the best of...
as much as we can in an appointment.
Right, exactly.
Yeah, and then the other point, what we talked about earlier as well, is the blood. Like, it's not common to get bleeding from an acupuncture point. Well, it depends on what you're doing. But most of the time, it's not common to get bleeding from an acupuncture point. It's probably less than 1% of the time I do acupuncture, I get bleeding. But when that does happen, it usually, unless you hit a capillary, but it usually indicates that there's a lot of stagnation at that point, and you are releasing some of the stagnation and energy. So a little bit of bleeding is not a bad thing. And, you know, in horses, for example, they do bleed, you know, a lot of these distal points around the hooves on purpose because there's stagnation, or, you know, they call them Jing-Well points, but it's kind of a mistranslation, but that's okay. But they will bleed those points on purpose to relieve stagnation, relieve pain, increase blood flow. So that's another thing that's with the Da Chi and needle retention and, you know, bleeding.
Yeah. So a lot of really interesting stuff with acupuncture. And I know we talked about different things that it can treat, but we use it a lot for pain management.
Yeah, for sure.
A lot for these arthritic dogs and cats and rabbits and intervertebral disc disease or herniated disc, anxiety, allergies, GI, a lot of IVD cases, internal organ, like you were mentioning, kidney, liver. I mean, it's, again, not a panacea. We're making it sound like it's the most amazing treatment out there. And I mean, I think it is, but...
But I've used it, like my acupuncture paper that I wrote, and I can't remember when I got certified. I want to say it was 17 years ago, but I could be wrong. But my paper I wrote was, or one of my papers I wrote was on kidney disease in a cat. It was a 19-year-old cat who had kidney disease, and the only thing I can do for this cat was acupuncture, and he let me acupuncture. His name was Leo, actually, I remember that. And Leo let me acupuncture him pretty well for a cat. And I couldn't do anything else. He wouldn't tolerate herbs. He would not do a diet change. So that's the only thing we did. And I tracked his BUN and creatinine, some kidney values. This is a long time ago, but and I watched them go down. You know, so and all I did was acupuncture. So I don't know if there's any Western modality that will bring down BUN and creatinine without changing the diet, without giving him fluids, without doing anything else. I literally mean that's the only thing I did for that patient, because it's the only thing that Leo allowed me to do. He lived another 2 years. And
that's amazing.
And then he did die of kidney disease. But 2 years with an animal who had a creatinine of over 3, and then we brought it down to 1.5, and then it slowly creeped up again. But that's the only thing that Leo allowed me to do. So when you say causation, correlation, etc., yeah, exactly. But this one's a hard one to ignore that did it, because there's nothing else in Western medicine that's going to bring it down. And in hepatic disease, I've had liver cancers that have done really, really well with acupuncture. Obviously kidney disease, Cushing's disease, you know, there's so many things, heart disease that you can use it for. But like you said, chronic pain is the big one. And then obviously neurologic conditions. So seizures, intervertebral disc disease, lots of other stuff. There's
a lot. There's not a lot of cases, unless I have a patient who is very fractious. There's not a lot of cases where I don't make the recommendation for acupuncture, because I feel like it would truly help.
Right.
I mean, in general, I feel like it truly helps.
Right.
And, it's all dependent. And if I feel like the patient won't let me put needles, maybe we start with laser acupuncture and build up to that.
Right. Exactly.
But, I feel very strongly that this is something very useful and beneficial. And when it comes down to it, do I care that somebody takes their dog to somebody who does medical acupuncture? No, it's still you're still doing acupuncture, you're still treating them, you're still helping them. And there's a lot of veterinarians that do house calls. So if you can't get your pet to the veterinarian to go get it done, a lot of clinics offer house call services, or veterinarians that's all they do.
Right.
And you can have them come to your house. They're in a comfortable environment. A lot of our patients eat while being needled.
Right.
No, we don't sedate them. We feed them. A lot of dogs rest comfortably. So yeah, it's.
Yeah, and sometimes those home visits are better for those increased fear and anxiety animals. So because they come into the office, and just being in a car or being in the office is too hard for them. So maybe try a mobile veterinarian and mobile veterinary acupuncturist, I should say. But I think pain, neurologic conditions, like I said, seizures, back problems, post-operative recovery, there's so many different things.
Yeah.
The gastrointestinal issues, my gosh, there's so many other cases that I can tell you about with cats with IVD that I've used acupuncture on very successfully to treat vomiting. So vomiting or diarrhea for that matter. Of course, I usually use diet change and herbs as well, but but just to think about, acupuncture in a different world. Like if you're doing medical acupuncture, kidney disease, liver disease, IBD is not something you're treating.
No, I feel like it's more musculoskeletal and neurologic.
100%.
Like those are the ones that are doing, and I could be wrong, I have not taken a medical acupuncture course, but a lot of it is more, you have lameness in this leg, these are the points you're going to do. And I mean, that's helpful for anybody doing acupuncture, but there's a lot more than just that.
Yeah, I'm really biased in that. Obviously, as I said before, it's a form of Chinese medicine, and it should be used in conjunction with everything else. And to take it out, medical acupuncture taken out of the whole system is I'm going to say it's wrong. But at the same time, it's right for some people who that's where their mindset is.
Right.
So that's fine.
Yeah.
But it will work for those conditions, but it won't. Medical acupuncture, I don't think they teach about treating IBD or lymphoma or something else.
Yeah,
like that,
I honestly don't know.
But if anyone knows, let us know.
Yeah, definitely. But this has been, I think just a great intro to what it is, what to expect.
Did we even cover what does an acupuncture session looks like, though?
Well, no, that's a great point. So
because we just been rambling.
Yeah, so generally the appointments at our practice, where we practice here, your practice, is 30 minutes. Yeah. And like we talked about, a lot of dogs and cats will eat, snacks. We have music playing in the rooms. I do like to dim the lights sometimes and kind of make it a whole experience for them, because it should really be relaxing. And then, we talked about the needle retention time. We put in these tiny little needles into the points, and then they just sit comfortably. And we usually have somebody sit with them, whether it's us or one of our assistants, and then we pull the needles. And I always tell the clients, hey, we're counting needles in and needles out. But if you find a needle, you can just let us know. And if a patient eats a needle,
that's a problem. I've never had it happen, but I hear it can be a problem.
But there's things that you do, right? You take a radiograph or an x-ray, you kind of assess it, you feed them a lot of bread or something that's going to bind that needle, and then you watch and monitor for it to come out. But you were saying you had a patient come in
just on Wednesday. It wasn't even my case. I looked at the x-ray, and there was a patient who had a sewing needle somewhere in their abdomen. I'm assuming it was lodged in an intestine somewhere, but I think it must have been like 2 inches long. And our acupuncture needles, first of all, so a needle like that, like a sewing needle or a hypodermic needle, is not flexible. That's a rigid needle. So these needles are slightly larger than the diameter of a hair, people say, but I usually use anywhere from, I've used 40 gauge, which is tiny, to 30 gauge, but But they're usually very flexible. You can take your finger and run it across it, and they'll bend back and forth.
Yeah.
So they're very flexible, very sharp. You know, I had someone ask me the other day if I ever reuse a needle.
Oh gosh, never.
And I thought, oh my God, that would hurt so bad because it's so sharp that it dulls every time it goes through the skin. So, although in the past I know people used to reuse acupuncture needles, but that's not. I mean, they're not very expensive. Come on, guys. So let's just use sharp ones. Be nice to the patients. But
sterility, you know, the whole thing.
Yeah, whatever, sterility. But yeah, they usually go in, right, and patients sit there, they eat, they relax. Sometimes they fall asleep. Usually they go in from 10 to 20 minutes, right? You would say sometimes a little longer in case you forget them. It could be an hour, but 10 to 20. Sometimes they just go in, go out, and but then how often do we usually do acupuncture?
It depends on the condition, but a lot of them I'll say, hey, we're going to start out weekly, and you know, because it's a cumulative effect. And I tell people, don't necessarily expect to see improvement after the first treatment. A lot of them will, but I give them the expectation that it's going to take 2 to 3 treatments, and then after we start to see improvement depending on what we're treating, then we start to space it out based on how they're doing. However, some of our patients get it every week or every other week continuously because of what we're treating. Yeah,
I'd say I like to try to do 4 to 6 depending on the condition once a week, and then start going every other week, every third week, once a month. However, if I have, I can think of 2 kind of conditions. Like if I have a really painful back, really bad seizures, or I guess a third, or even cancer where the patient's not eating, then I might do it like twice a week. Well, I mean, for the really bad, really bad backs, I've done it every other day, you know, for a week or 2. That's pretty rare, though.
Yeah, I don't usually do them more than that. I do have some that will do twice a week, but not often. And it's usually because they have cancer and and they're on chemo, or they're just not feeling well, and I need to kind of help them with their nausea and getting them to eat a little bit, because there are specific points for nausea. And, you know, the C-bands that people wear, that's an acupuncture point, guys. Yeah. And they're pretty effective. So...
I've used them before, and I used to get seasick a lot, and they were very effective.
Yeah, I'm pretty sure I have one in like every bag in my car. Like,
they might be a little nerdy.
A little bit, but they're great, and I think it's really helpful.
Yeah, so that's what it usually looks like. They usually either fall asleep or relax, and like I said, they're usually really small needles. And then what does acupuncture do for like a mechanism of action? We talked about that a little bit, right? Endorphins, serotonin, blah blah blah.
Increase circulation.
Right, exactly. Autonomic nervous system activity, nerve regeneration. Yeah. I remember the first time I ever did Circle the Dragon. So there's a technique called Circle the Dragon, and it's basically if you have a non-healing wound, you stick a bunch of needles around that non-healing wound, and you stimulate those needles. And I didn't know what I was doing. This was years ago, and so I stimulated them, and I was like, okay, we'll come back in 2 days or 3 days. Let's do it again. Well, the first time nothing happened. The second time I did it, I noticed about half the acupuncture points that I used had blood coming out of them. Wow. And I was like, oh, dummy Carmine, I know why this is working. This is working because I'm stimulating blood flow. You know, it was the most obvious case of stimulating blood flow that it was a great teaching moment for me to realize that's what I'm doing. It's not magic. I'm not circling a dragon. I'm fucking bringing blood flow to an area that's not healing. So what do you do for an area that's not healing? You bring blood flow to it. You know, so it's one of my pet peeves, by the way, is when people call themselves, I'm going to get in trouble right now. When people call themselves healers, like I'm a pet healer. You're not anything. All you are is somebody who knows certain techniques and also knows, you know, how the way the body heals, and you're directing the body heal. I'm not a healer, you know.
But you know what? You are, in the sense that you are allowing for that healing to take place. You are helping that. So if somebody calls you a healer, just say thank you.
Okay, I'll be like, no. Anyways, I just always figure for myself, it's like I feel I'm taken out of the equation because I'm just directing the body on what to do and how to heal itself. Right. Whether it's herbal mechanisms or Chinese medicines or whatever, you're just giving the body the tools, the nutrients, or whatever. And yes, you have a knowledge base. Yes, there's definitely an empathetic aspect of doing this that obviously is healing. I mean, I swear to God, I should charge people for being their therapist, because when we're in that room once a week, we talk about stuff, man, some deep stuff, you know. So, I mean, a lot of my clients that I've known for years are, you know, I would consider them friends of mine.
Of course.
Because we hang out once a week for 20 minutes. I don't do that with hardly any of my friends.
Right.
You know?
You get to know them pretty well, and you get to know their families, and hey, how's this going and that.
Yeah.
But I think I'm going to start calling you Carmine the pet healer.
I'm going to punch you in the face. But yeah, so blood flow is a really good way to do, you know, is one of the things that acupuncture obviously does, is increases blood flow. That's why you don't want to use it around a tumor. That's why you want to use it around an ulcer that's not healing. You definitely want to try to get acupuncture blood flow to those areas. So I don't know. Did we cover everything we wanted to cover in this? I mean we kind of rambled around.
I'm pretty sure we've gotten.
Just make sure
no pun intended. We got to the point.
Yeah. we went around the point. Also, no pun intended. You know, for quite a bit. But you know, just make sure that if you go to do acupuncture, have reasonable expectations. The animal's not going to get better in the first session.
Yeah.
You know, it may take 4 to 8 sessions. The animal might not get better, and maybe that's not the right modality for that animal, and that's okay too.
Right.
Also, make sure you've gotten it done by someone who is certified in one of these organizations.
Absolutely.
I mean, there's a few, right? I don't know.
Yeah, there's Chi University, or previously Chi Institute. There's IVIS. There's the American Academy of Veterinary Acupuncture. Then there's all of these medical acupuncture courses that are coming out.
Right.
So, you know, and there are veterinarians that have taken these courses. They're just not certified because they haven't done the case study or whatever, but they're still trained.
Right.
So just make sure somebody's trained and ideally certified, and you'll see initials behind their name, CVA, Certified Veterinary Acupuncturist, or something similar. Every place is a little bit different. And just talk to them about, you know, what questions you have. That's really the best thing, and go from there. But be patient. Everybody starts somewhere. There's people constantly getting trained in this, and you know, it's such a personal modality. I mean, we're using energy, we're using our hands, we're using intention.
We're healing animals.
And you're a healer, Carmine the healer. And I think with that being said, sometimes it could be a little challenging to do some of these very empathetic therapies if somebody is constantly bombarding you with questions, or so that could be a little bit challenging, because you're trying to focus on what you're doing, and it almost turns into a recheck exam, because there's like constant questions. And I don't mind questions when I'm doing acu, but it's just like I also need to focus on what I'm doing. So let's just give it a second and let whoever's doing it, especially if they're doing it early on, or it's a complicated case, or the patient's being a little refractory, like let's just focus on what we need to do. Yeah.
That's cool. Yeah, and I guess that was what we wanted to talk about at our first session. And then next week we're going to talk about the research pros and cons to acupuncture. Right? Yeah.
Thanks for joining us, everybody.
Yeah, that was fun.
Yeah.
Thank you.
Thanks.
Bye.
Carmine the healer.
I hate you.